these energy sessions, these external Qigong sessions, leads me to feel even stronger towards wanting to validate this approach, because now I'm supporting a group of patients who have improved via this approach when none of the other approaches were able to help them. And, we'll kind of like say, we think it's because there is an energetic circulation. We feel it, we experience it with Dr. Yanuck, we believe in the treatment, and that if modalities can be offered to help us, maybe those same modalities will help others with this condition and others. And we want these folks to be treated seriously so that ultimately it will be accepted within conventional medicine to help people.
Atma Namaste, everyone. Welcome to the Pranic Healing Podcast. On this episode, we're going to talk about an ancient healing practice called Qigong. And our guest speaker today is Dr. Michael Yanuck. He is an MD PhD physician scientist whose groundbreaking research at the NIH was the basis for an FDA-approved vaccine for cancer. And following his personal experience with a traumatic injury, he was treated and trained in bioenergy and Qigong. He introduced energy medicine approaches to the NCCIH and integrative health and worked with Qigong masters on the President's Executive Committee on Alternative Medicine. In 2023, Dr. Yanuck was the recipient of the coveted Science of Taichi and Qigong Award from Harvard University for his use of external Qigong to assist veterans with problems of severe traumatic brain injury. And in this episode, we're going to talk about his really exciting research with long COVID and how that shows implications for the future in using Qigong and bioenergy in integrative medicine. So without further ado, please welcome Dr. Michael Yanuck.
Thank you, Jason.
Well, it's a pleasure to have you on the podcast again, Michael. I know it's been a little bit of a while, but you've been up to continuing your ways and moving this work forward. So I would love for you to kind of share just a little bit for the audience who might not know exactly what is Qigong exactly, and how is it different from other like bioenergy or energy medicine modalities in your experience?
I guess I rather regard Qigong as the ultimate in terms of an energy healing modality. It offers the potential to release the turbid qi, the retained energy of trauma from people who are suffering, mostly from chronic conditions. And it does it in a myriad of ways. But the thing that I love about this modality, I suppose more than anything else, is that I believe it really taps into the innate intelligence of the body and works with that innate intelligence of the body to help the person heal in a way that gives to the person what that person needs, when that person needs it, where that person needs it, how that person needs it, at the exact dose required, and is never forceful. And as well as giving so much to the recipient of this approach, I hold that it also gives back a great deal to the practitioner, because the way I treat Qi and connecting with the Qi field is that it's never a one-way circuit. I think it's always a two-way circuit. And at the same time that a Qigong practitioner is reaching to help the person that he's working with, it's my experience that the recipient also happens to be reaching back to the practitioner to help that person. So it's just a win-win kind of therapy that, from the moment that I found it 30 years ago, essentially became the calling of my life.
Yeah. Well, I'm so happy that we can speak on both, on our passion and calling of our life. And, I think that's a great way you explained it, Michael, that kind of giving and receiving aspect. And, in pranic healing, which is also a modality that's very similar to external Qigong, we talk about what you've mentioned, how there is a giver and a receiver, but also the giver has the benefits as well, because the energy is flowing through you and you get part of the benefits as well. So I'm really excited to kind of dive into the research that you've been doing. But first, I know that you wanted to share, again, a couple pieces of the information to kind of give context to the audience. So I will give you time to set that up for us, Michael. And for those listening on the audio version, I recommend you to watch the video version so you can see the PowerPoint and video that Michael will be showing for us very shortly.
Well, thank you very much. Okay, so I'm going to show the PowerPoint that I recently delivered for the International Taichi and Qigong Association Conference. So I call this External Qigong and the Treatment of Medical Conditions. And you gave the introduction for me, and I'll be talking more about myself as the presentation goes on. What is Qi? Like I basically said, Qi is the life force energy, is function, and you put it together. And for me, I treat this like a Chinese healing modality that works to release turbid Qi, release the retained energy of trauma, so to help the person acquire optimal function. And I basically treat this in many ways like acupuncture without the needles. And how did I get interested in it? As you said in your introduction, I was working on cancer vaccines and I suffered a leg injury, and conventional medical approaches were not able to help. And as a last resort, I turned to what was then defined as alternative medicine. And I tried a lot of different approaches. But when I got to Qigong, finally it brought everything together. And for me, my Qigong experience had two parts. There was the internal Qigong, in which you look to connect with the universal Qi, this universal blueprint that has essentially within it the information to help release all turbid Qi, retained energy of trauma, to help the person gain back optimal function. But then within a year of my training, I was offered the more advanced training in external Qigong, whereby a skilled Qigong practitioner works with the person to help that person release the retained energy of trauma, the turbid Qi. Now, that was back 30 years ago, 30 years in the future, and basically the VA announces an Innovation Accelerator program in which they say we're looking for innovative approaches to help our veterans. And so I basically raised my hand and said, well, I've been doing Qigong for 30 years. Can I offer that? So I treated veterans, I trained staff, and the first case that I'd like to share with you involved a veteran with left-sided neurologic deficits following a severe traumatic brain injury and intracranial hemorrhage with a right subdural hematoma that left this veteran with left-sided neurologic deficits. And despite treatment with physical therapy and occupational therapy, he had residual left-sided deficits. And basically, I approached him and asked if he'd like to attempt Qigong. And what I'm going to show is a very short 4-minute video, but it offers how it is that I work to demonstrate Qi to folks, give you a little bit of the external Qigong session, and then get to see the before and after. So this is the video, and in order to be able to hear it, I'm going to take us all over to the website for the video, and we'll play it.
There's a lot of, not a lot, but there's still numbness, and especially these two fingers, the side of this one.
Okay.
And then just the collaboration. If I close my eyes, can I hit my nose?
Yeah.
Try pretty hard. Like totally guessing it. I'm a little bit off. But everybody can do that,
Spatial orientation. Yeah.
There's just some disconnect still. You've seen one of these before, right? This you go like this.
Yeah.
Right?
Yeah.
Can't do that here.
If you would, please demonstrate with your left hand.
Okay. I even tried shaking both hands, but then I can't coordinate it to get it to go straight. So there's that, and the nunchucks. Well, yeah. With the right hand, everybody knows how to spin a nunchuck. I could even go so far as to, get the whole figure eight thing going without hitting myself. But now I get it. I have to like move my whole arm to get it to go. Where this one is just a flip of the wrist.
Right.
As I understand it, everything's contralateral. I have a traumatic brain injury, right side, loose skull, big prosthetic, whatever. So I have left side damage. I was contracted and all that kind of stuff with the left hand.
Now I'm going to ask you to kind of like feel over my hand and see if you don't perceive a point. About 6 inches above. Move it around and see if you don't perceive something.
Yeah, it's not a warm sensation like it was, but it's sort of like that rubber ball is there, and I just wanted to touch it.
Very interesting.
And then, no, there's the warmth in our palms. There's an energy there.
Hey, if you feel ready,
We'll
see what's going on now.
Yeah, we'll go with the heavy hitter stuff first. Good side. Easy. Good side. Now let's try the bad side. There is something. For those thing, that was the first time go.
Last time you hit me.
Yeah, I went like over here.
Yeah.
With my right hand, which is totally unaffected, totally normal, I can totally bounce this bad boy all day long. Now with my left hand, not quite so easy. So that's what we'll see. That's a lot of effort, but I'm doing good. I'm hitting it. I didn't do this last time. Shall I demonstrate for the nunchuck, please? So with the right hand, it's just like a snap of the. It's just so comfy. I could do this for 25 years and never get fatigued. Now let's see with the left. Okay, it's like with my right, I could. Oh God, now I'm totally doing it. No, this is not how it was. It was much harder than this. But that's just tangible things that I can objectively see difference. So this is my therapy choice.
Wow, that was very impressive. Even though seeing the video again for the second time on the podcast, Michael, that's kind of cool. And I didn't mention this the first time. I'm really impressed you have nunchucks at the office there. It sounds like you're really into the Chinese medicine. Not a lot of therapy offices have nunchucks in their supply section there. But it was really cool to see.
Yeah, we certainly don't have the nunchucks. Basically, the veteran really kind of surprised us because he was the one who, in many ways, drove the project, at least where he was concerned. In all honesty, this project was mainly meant to train VA staff in this form of Qigong. And I basically kind of like tapped this veteran because I thought that he'd have a lot of turbid Qi for which to serve as a good subject to be able to teach folks how to perform external Qigong. But he had other ideas. He wanted to use this approach to help him get better. So he brought in the bouncing balloon. He brought in the nunchucks, things that he had tried to improve at for years and hadn't made improvements in, but was hopeful that the Qigong would help him improve. And indeed they did.
Yeah, I mean, again, looking at that video again, it's so amazing to see just right after that session, the physical improvements in his coordination and the dexterity. That was really really impressive. And just kind of relate to it. It's so interesting how you, and this connects back to what you were saying in the beginning, how in qigong it's really you get the benefits of for the not only the recipient but for the practitioner. And it sounds like you had this project going in for teaching purposes, but he had another idea which really really worked out amazingly well. So I just had one question, Michael, that I didn't get to ask, and I know that I've wanted to ask you this before, but when you talk about this retained turbid chi, correct? Am I pronouncing that correct?
Turbid chi, retained energy of trauma. Yes.
Yes, retained energy of trauma. In pranic healing, in acupuncture, we call this energetic congestion, if you will. Basically, the energy is blown up, it's stuck, it's not moving. I wanted to ask, what are you feeling as a Qigong practitioner? Maybe that'll help, other therapists of all different types of energy modalities connect, because at the end of the day, I believe we're working on the same basis, right? So how is your experience in working with this, retained energy of trauma, as you call it?
Sure. Yeah. So what I do when I, work with folks is essentially the same as what I'm doing when I offer the chi tangibility exercise. Kind of like completely is meant to take the mystery out of this. Because just as people are typically perceiving a discrete point of energy, coming from a discrete point in my hand and another one in a discrete point in my forearm, I'm looking for discrete points of energy when I scan folks for those energy disturbances, those places of turbid chi, retained energy of trauma. And then essentially just by connecting with that retained energy of trauma, that turbid chi, I just follow the path. Typically for me, I perceive them as a breeze. They have a directionality to them. And if I follow them to their completion and just move with them the way that the chi directs me to move in the direction that it directs me to move with that retained energy of trauma. Typically, that retained energy of trauma leaves the person. That's my feeling. Now, what else might be happening, when, this kind of connection is affected? Is healing energy being sent to the person? By connecting with the universal chi at the same time to serve as something of a medium and a conduit to send healing energy from the universal chi. Is there more to it than that? I mean, for me, I typically think of this process like a couple of computers syncing. That is, that I'm coming to the person who maybe has, something that I'd say is akin to a damaged program, like this veteran. He had neurologic systems that weren't working and resulting in problems of residual neurologic deficits. And maybe, like I said, it's like a couple of computers syncing over this energetic circulation, this chi field, whereby by tapping into my system, like syncing with another computer over a fiber optic cable, the two computers are able to see each other's programs. And the one computer with the faulty program can kind of like look at the other computer and say, oh, that's how it's done, and reboot itself. So instead of being in a loop that doesn't go anywhere, that doesn't get the program working, that rebooting process gets that damaged program working again just by tapping into like the other computer so that it's working again. And therefore, that energy loop is gone because the program is now working. It's no longer, expending this energy and not getting anywhere. That's what I think is happening essentially when I work with folks, that they're kind of like, if they can, tapping into my system where their system isn't working and saying, aha, that's how you do it. And whereas there were probably neural cells, neural networks in the veteran system that were stunned and traumatized by the traumatic brain injury and everything that went along with it, it didn't mean that that system couldn't get going again. And by essentially tapping into my system via the energetic connection and the energetic circulation, that information could be connected. And so the neurologic system could go back to optimal function. What I rather believe explained the veteran's improvement.
Yeah. Yeah. When you say that, Michael, it really, I think of it like almost like a top-down approach versus the bottom-up approach, which the bottom-up is more of like this mechanistic physical hardware view of the body, as conventional medicine might see the body as, but then there's this software that interacts with this chi field that you mentioned. And like you said, if we can kind of correct the software, the hardware can kind of follow through, right? And you mentioned like following a breeze, a path, a beginning and an end. And I think that's just so refreshing to hear, especially from someone with you and your credentials and your background. So that's really exciting. And I want to kind of take this a little bit further, because you've done even more work beyond just that simple case study. Is now you have a pilot study in working with long COVID patients. So can you demonstrate with that and share a little bit of the PowerPoint again to help us understand a little bit better there?
Yeah, I'd love to. Thank you. So going back to the PowerPoint, I'm just going to briefly say that it continue from where from the video, just to say that the veteran improved for motor strength, coordination, and even sensation as the Qigong sessions continued. So that after essentially 12 sessions, the veteran was calling it success overall, felt 98% better. And a year later, all of these improvements were retained and sustained, and he was doing even better with typing skills that were just getting better and better, and typing speeds that were faster. The next veteran that we worked with had problems of chronic pain and opioid dependence, an older veteran with multiple joint replacements, taking opioid medications and having become dependent on those opioid medications. And with the external Qigong, he essentially immediately experienced diminished pain, decreased opioid reliance, threw away the hydrocodone pills, these after 15 years of taking them. And also his withdrawal symptoms went away. So that whereas before he had a clinical opioid withdrawal score of 14, after the Qigong sessions, it went down to 0. No opioid withdrawal symptoms at all. It happened that not long after we'd been working with this veteran for the problems of pain and opioid dependence, he contracted COVID-19 and then experienced symptoms of long COVID. And he came back to us and basically said, can you help me with the long COVID symptoms? And sure enough, the external Qigong was able to help him with those long COVID symptoms. It also happens that the patient developed RSV pneumonia and became oxygen dependent, and then, basically appealed for our help where that was concerned. And the external Qigong helped him with that as well. So that the same time or same day that we performed the external Qigong, he was feeling less anxiety about breathing, got off the oxygen. Now, going back to the long COVID. So here's this condition where the mechanisms remain nebulous. The etiologies are many, and there are many associations when it comes to long COVID, and even more symptoms. And even though this looks like a long list, I've seen long COVID sufferers with every single one of these symptoms. And the question became, could we use external Qigong to help long COVID? I'd had some success treating folks with post-viral conditions, whereby it seemed like an acute respiratory infection left someone with retained energy of trauma so that it developed into asthma, and with external Qigong was able to release that retained energy of trauma and the patient's asthma went away. Could that work with a condition like long COVID? Could we treat this like The person's system had been traumatized, and there was retained energy of trauma that was driving a lot of the long COVID symptoms. So put that forward to UC Davis. The folks at the UC Davis Integrative Medicine Service and Pulmonary Service decided to put forward a long COVID Qigong pilot study. And the design was such that we were going to use a waitlist controlled trial to see if this would help long COVID sufferers. We basically put these people into small groups, about 4 to 12 people, and treated them weekly over 6 weeks, sessions lasting 2 to 3 hours, depending on the group size. Like I said, this was a waitlist control study so that we had an immediate group and then a waitlist group, so that ultimately everyone in the study received treatment with external Qigong. And again, this was a randomized control study, which it was considered a strong design for causal inference. Should the intervention, that being external Qigong, make a difference? This is a description of the external Qigong method used, basically what we just talked about when you asked me how I perform this. The demographics of the folks involved, mostly women, mostly white. When it came to the tangibility exercise and these folks' qi perception with it, 80% of folks were able to perceive qi, discrete points of energy from my hand and forearm when we performed this test with them. And the most extraordinary thing was the results when it came to this study. And that was that we found that for these folks with long COVID, they had improvements for social roles and activity, anxiety, depression, fatigue, pain, and near statistically significant results for improved sleep and cognitive function. So a study that really exceeded my expectations.
Yeah, that's incredible. And to know that it was such a, well-designed, rigorous in terms of the methods, being it randomized and controlled, I think that's a really strong point, like you mentioned, Michael, because I find, as you may know, studies and research efforts into, whether it's Qigong or other energy medicine modalities, there lacks that quality of randomization and control part, which is very important when we're talking about something so intangible, right, as qi and the effects of it. So that's really amazing. Now that we've kind of gone through, the case studies and now, going through this pilot study, what is your takeaway of these results, Michael, for you yourself as the investigator and as a practitioner? What's your takeaway of all this?
Like I said, these results really far exceeded my expectations. I mean, this was really something of a Hail Mary to think that retained energy of trauma might be a source of these long COVID folks suffering. And I was hopeful that it might help some of these participants in this study, but that it helped as many as it did was really quite extraordinary and speaks to a lot when it comes to the potential involvement of the energetic circulation when it comes to people's chronic conditions. And also, naturally, the potential power of this method to help people. Because like I showed in that one slide, the possible etiologies are significant. Was this because these people were suffering from things like autoimmune disorders? It very well seemed like it could have been that way to me. Can we basically make the extension from this that working at the level of the energetic circulation might help somebody with problems of autoimmune disorders? It's really kind of an extraordinary thought and possibility for me. But given the results of this study, it's literally kind of like made that a possibility.
Yeah, yeah, and I think I go back to what you're saying. There seems to be a universal underlying connection with when we talk about health. And like I mentioned, I find that, Qigong and these energy therapies come from a top-down approach where, this universal life force energy appears to play a role in, in all types of conditions. And it doesn't matter if it's just a simple, neck pain or back pain to all the way to, post-traumatic brain injuries, long COVID, you name it. And you mentioned the autoimmune connections as well. It's really, really exciting to see it this way, and the way that you've presented it in a very clear, objective manner, because I think that's so important moving forward, to potentially integrating this in a more larger scale basis, which leads to my next question. Now that we have these results, what do we do with it, Michael? What's like the next steps from here?
Yeah, when I kind of shared this with the president of the International Medical Tai Chi and Qigong Association, his response was, okay, you need to repeat these results 10 times, or else in one significantly larger study, show these results. So basically, it's, more efforts towards validation is what needs to be done.
Hmm. And I think that that's the way with science, right? We just can't extrapolate from one study and say it works across the board. But I hear you. Being a person that has worked with people on an individual level, on case study levels, I know for sure that it works. But these things take time and money and resources, of course. So I'm sure that will come forward. In terms of sort of the future for you, Michael, besides doing more of these research, probably making the studies a little bit bigger, larger sample size, where do you go from here? And do you see yourself doing the same, or is there more to it that we've yet to see? Because this is really exciting stuff in terms of your progression in working on this research.
And no, I think this is kind of like, this is me. This is what you'll kind of like be seeing in terms of, the folks out there who are doing the work to really be able to measure the qi and develop something of a qi detector machine. It's my hope that studies and results like these will spur that research to continue, move it forward, because we need that piece. It's kind of like you said in the beginning, and I believe all these different approaches, we're all working at the same thing, at the energetic circulation of the body. But in many ways, I think we're all kind of like, without that device to really define the energetic circulation of the body, in many ways, I kind of wonder if, we're not winding up, kind of like, approaching it at one end, like, the three blind mice evaluating the elephant, where, the one mouse says, oh, I know what an elephant is. It's this, kind of like short, shaggy thing that comes from the back. And the other one says, no, it's this tube-like thing that comes from the front. And, the other one says, no, it's this really hard thing that kind of like comes off from the front of the side. And so we're all working at it, and we're all working at it at these different levels. So, it's like, it's all important. And it's very interesting to me because, obviously, there's a reason why I, have gravitated towards Qigong, and Qigong means so much to me. This is the approach that just resonates and works for me. Whereas, for you, it's pranic healing. And for somebody else, it's acupuncture or healing touch or therapeutic touch. So, this is just, the energetic circulation is what I consider the final frontier of human physiology, and something that needs to be studied in a lot of different ways with, guys like me doing this kind of clinical study work, and other folks who have higher power cortices who I think are moving towards being able to develop that chi meter and define the energetic circulation better.
Yeah, well said. I mean, we're working the way you described the elephant piece and how this is like the underlying material or principle we're working with is kind of like it's like the analogy that I see in my head. It's like you're in the dark and you're trying to figure out what type of animal this is. And you mentioned the elephant. This is the trunk. This is the leg. This is the tail. We're all just kind of like tapping it because we can't see it. But until science has a device that can measure this chi, it's like turning on the lights and that's an elephant, right? We see it all for what it is, and we don't have to guess is this the trunk, is this the tail, is this the foot? Because with that'll be the day that we will have a fundamental basis to explaining all these amazing phenomenon that you've mentioned in your work and research. So I totally resonate with what you're saying, Michael. So awesome. Any last words of advice for regular people, doctors, researchers on qigong? Like, I'm sure you've talked to so many people of all different levels of understanding to this, but what's like your one big piece of advice for those who are interested but not so sure if it's going to work, but they heard some things? What do you say to those people, Michael?
The same thing I kind of say to myself, be patient. For me, it's kind of like there's a story about a fella named Dr. Semmelweis who lived in Austria-Hungary in the 1850s, and he was a obstetrician. And back then, so many women were dying as a result of childbirth. And he found that by washing his hands in a lime solution, he was able to reduce the mortality of, purpuric fever, infection, the sepsis following childbirth, from 30% to 2%. But he didn't have the kind of science behind him that would illuminate it all. Even though Pasteur and Lister were just some 10 or 20 years away, that was far enough away when it came to understanding germ theory that his call was not accepted. And he was really treated quite brutally by the medical profession, who ultimately, basically sent him to an asylum where he was beaten and died of his wounds within 2 weeks of, being sent there, because he was considered inappropriate, you might say, by his medical colleagues. So, in many ways, we're unfortunately all kind of living in this time, and I think we all have to kind of like be patient with each other. There's a place for conventional medicine. I literally don't want to work with someone who's suffering from a medical condition until they have been thoroughly evaluated by their doctor, so that patient can come to me and say, I've been thoroughly evaluated by my doctor. The doctor wasn't able to find anything that conventional medicine could address. Could we try your approach? That makes me feel safe. Like, I'm not going to do something to kind of like give people a false sense of security and then lead them towards delay of care when really they had something underlying, something significant, a cancer, or something of that nature that really needed to be found by the conventional medicine, and at the very least evaluated, diagnosed, prognoses offered before this person came to me. So, it's exciting, obviously, with the kind of results that I got to see with this study, all I want to do is help more people with this approach. But there needs to be a balance. We all need to be patient with each other in terms of, how about this energetic circulation? How can you put it forth when you can't, see it or offer significant validation for it via some detection machine? And it's like, well, look, I put it forth because it helped me. for 30 years, it's been helping others. And now, I'm beginning to do the randomized controlled studies to suggest that there's more to it than just it helping folks in a case study kind of fashion. And therefore, it's my hope that this is going to create some tolerance. I mean, I'm going to tell you something that did kind of bother me recently. Not long after the results of the study came out, I shared it with a colleague, and the colleague kind of like says to me, well, Dr. Yanuck, you wonder if, just a caring physician like yourself coming to long COVID folks and talking with them about their condition and having a good bedside manner and doing things like meditation a couple of hours a week wouldn't make the difference for, these participants, just as much as, your external Qigong did. And I lead a post-study group of these folks now. And I shared with them, my colleagues' thoughts. And, they responded that they really did think it was the external Qigong piece, that it was the release of retained energy of trauma that made a difference. But more than that, after they left that session, it just seemed like they were deflated in some way. And without prompting my wife, who comes with me to these sessions, she says to me, Mike, those folks really didn't like that question. And I say to her, Sarah, yeah, can you elaborate on that? And she says, well, look, Mike, it's just a feeling that I got, but it just seems to me that your colleague's question just not only spoke to you and your approach with helping these folks, but also it spoke to maybe their suffering and how they were treated. That all you need to do is give these folks a little bit of attention, answer their questions, offer some good bedside manner, do some meditation with them, and that's all they need, because they never had a problem in the first place. Long story short. And, that really struck me. It was like, yeah, want these very courageous people who kind of like got involved in this study, of which none of them had ever had any exposure to external Qigong or energy medicine practices in general, and did well with it. I don't want them to be looked at as just, you'll forgive me for saying it, but quote unquote head cases. And all they had was, a mental problem where they're working with me and they very tangibly perceive these energy sessions, these external Qigong sessions, and feel the difference that it makes. It leads me to feel even stronger towards wanting to validate this approach, because now I'm not just working to validate something that has helped me and that I feel like has helped others. Now I feel like I'm supporting a group of patients who have improved by this approach when none of the other approaches were able to help them. And, we'll kind of like say, we think it's because there is an energetic circulation. We feel it. We experience it with Dr. Yanuck. We believe in the treatment. We believe that we are more than just head cases. We believe that we suffer from this retained energy of trauma, and that if modalities can be offered to help us, maybe those same modalities will help others with this condition and others. And we want, these folks to be treated seriously. We want a condition of disturbances of the chi field and the energetic circulation to be treated seriously, so that ultimately it will be accepted within conventional medicine to help people.
Yeah. Well, I have to say, well said, Michael. I think I resonate with your emotions and sentiments on all levels there. And it speaks to, not only, again, of course, you as the practitioner and the investigator, but to the people and their suffering, and almost kind of invalidating what they've been going through and how they've received the treatment as well. So I definitely commend you for holding strong to the pole of this type of therapy, because it's I've seen it work for myself, and I've seen it work for others. And it goes back to what I think is when you mentioned about that doctor is like, we used to think that the earth was the center of the universe, right? That the sun revolved around the earth. And then we found out later, actually, the earth revolves around the sun. And I think that we're moving to this point now in a new frontier, like you've mentioned, where, the way I describe it is, for me, is like, what do you believe to be true and has yet to be proven? And I think we're both on the same case here, is we believe in this universal life force energy that sustains the body and that can be applied in a way to support the body, physically and emotionally and, on other levels as well. So yeah, thank you for sharing that. That was very inspiring and motivating to hear and listen to. And yeah, I'm glad your wife brought that up to you, as all good wives do. They're so in touch with the emotional side of things. So amazing, amazing. And how can the audience get to reach you, Michael? I know you have a couple of books in different publications there. How can the audience find more about you and your work?
And they can write to me. My email is michael.yanuck@va.com.
Okay, excellent. Yeah, I will leave that in the description for the video and the podcast. Well, it's always been a pleasure, Michael. It's always been a pleasure to speak with you on this topic, and really excited to see this amazing work that you're doing and trailblazing for us. So this conversation, I'm sure, has helped many people in all different areas, and I hope, much blessings and best wishes on continued success in this area. I think you're doing amazing work for humanity right here, Michael. So thank you so much for your time.
Thank you. And thank you so much for permitting me to share this with your audience. Thank you.
All right, everyone. That's all for today's episode. Thank you so much for listening, and we hope to see you next time.